but it's sort of an artistic thing. You don't want to be 100% like a mathematician on it.
People may not realize that lip lift surgery or lip enhancements can actually make you look younger.
When they smile, you may not see much of their teeth, and those are the ideal candidates for considering a lip lift procedure.
What is it about a full lip that makes a face look feminine?
Too much tissue, you can distort the base of the nose and distort the lip as well. So
It sounds like a deep plane facelift on your lip.
it is in the sense, some people have sort of coined it that. Okay, guys, I hope you found that informative. Thanks for taking the time to listen to another episode of Unfiltered. Today's episode on lip lift was, my...
Uplifting?
Yeah, it was uplifting. Hey everyone, it's Dr. Solomon and welcome back to our podcast, Unfiltered. Today we're going to be talking to you about lip lift. This is a common procedure which has been trending over the last few years, and I've been doing this operation for over 20 years, and we're going to discuss some of the common facts, fictions, myths about the procedure, and I'll turn over to Nancy now for some questions.
So we're going to talk about lip enhancements, lip lifts, the combination of both. Now, lips are just beautiful when they're fuller and a little more lush, and they became it became very trendy. I don't know if I can attribute it to Angelina Jolie like 10, 20 years ago, but that's when everyone started taking note of lips. So women love them, men love them. Now, a lot of people will start off with non-surgical treatments to enhance their lips and make their lips look a little bit fuller. Let's start off talking about what those options are. So there's filler, fat grafting, and even a neuromodulator called Botox that can sort of enhance the lip. So let's discuss those options first, the non-surgical options.
Okay, so we're going to talk about non-surgical options for lip enhancement. Botox is one of the options, neurotoxin, you mentioned it in your question.
Also known as a lip flip.
Yeah, it's a common procedure. It works very differently than filler. What it's doing is the muscle around the mouth, called the orbicularis, is basically constricting the lips. It's used to close the lips. It's a circular muscle around the mouth, and it was identified that if you put a very small amount of neurotoxin or Botox right on the border of the lip, it'll weaken the muscle just to that area and allow the lip to evert slightly out. So that's a lip flip. It's very subtle, but it's very common, and it's a nice add-on. It can be done on its own, or it can be done in combination with lip filler. So lip filler is the commonest lip augmentation procedure that's non-surgical, probably carried out worldwide. It has some beautiful results, but it also is notorious for potentially giving a telltale sign that something's been altered or done. Depending on someone's initial anatomy, it may be a great option for them, but it has got, like everything else in cosmetic surgery, some limitations. And then there's different styles. There's subtle lip augmentation, medium lip augmentation, dramatic lip augmentation. In the dramatic category, some people have trademarked or put certain names on it. One was the Russian lip flip, I think, or the Russian lip augmentation technique. And that gave like very dramatic accentuation of the lips, which could be, attractive on certain facial shapes, but it can look a little bit bizarro, I think, if not done by the right care provider, or if excess amounts are done on the wrong lip. So what can go wrong with lip filler? Lip filler, like anything else, can be done beautifully, but it also can be done not so well. So the lips basically are divided into red and white lip.
White
The
lip?
white lip being sort of the upper lip here, just known as the white lip. And that's basically from the base of the nose to what's called the vermilion border. Then there's the red lip, and then there's a wet lip, dry lip junction. And depending on where you're augmenting, you're going to make different shapes and sizes of it. So that's basically the whole topic of lip augmentation with volumizing, which would be filler or fat grafting, is where do you put the filler and how do you change the shape and what type of shape are you trying to achieve? So if you're putting in the filler and you're just filling the entire lip, you're going to create two sausages, and it's going to look really odd and augmented and not great.
Duck-like.
And if you put too much in the upper lip versus the lower lip and make them disproportionate, where the upper lip's bigger than the lower lip, that can look like a duck lip. If you put in excessive amounts of filler into a smaller lip and keep trying to fill, like you're filling up something and it can't really hold it, it's going to then spread. You're going to get what's known as filler migration,
Goes up here.
or a filler mustache, they call it. So all of these things sort of we see literally on a day-to-day basis. And these are the things that we sort of have to educate patients about, work with them to sort of resolve things, and also express the limitations. Because some people bounce around the city wanting to augment the lips. I just want it like this, and it may not even be possible with non-surgical options alone. Even with surgery, there are some limitations. So those are the important things to sort of make sure the patients are educated about.
So when is it time to try something other than lip filler to enhance the lips? When is it time to go the surgery route?
So we often see patients, because it's a surgical practice, who've already had lip filler and haven't been happy with it and are looking for alternative options. So that falls into two surgical categories, one being a lip lift, and the second category being lip augmentation with fat grafting, patients looking for a more permanent option than the filler. So these may be people who really like the filler, the results that they've provided, but are tired of having it done or looking for a longer term solution. They would be a candidate for fat grafting alone. Then there's people who basically have anatomy with a small or thin upper lip. They have often a long upper lip, maybe even congenital long upper lip, or due to the aging process, the lip may elongate. When they smile, you may not see much of their teeth. And those are the ideal candidates for considering a lip lift procedure where you're actually shortening the upper lip. And when you shorten it, you're going to be creating a eversion, and more of the red lip is going to show and less of the white lip's going to show, and more of the teeth are going to show. And that can be done, again, alone, or it can be done in combination with fat grafting or filler. So you get a few different options available to you. So again, neurotoxin, lip flip, filler, lip volumization, fat grafting, long-term lip augmentation, lip lifting, changing the architecture and shape of the lip. And then the last option is corner lip lift. Corner lip lift is a different operation where you're making an incision right on the red-white junction known as a vermilion border. And that's a add-on type of procedure, which can be done, again, alone for people who find that the corner of their lip is down and they're happy with the volume of the central lip. Or in combination with a conventional, what's known as a subnasal lip lift, where the incision's under the nose, the lip is shortened, but the corners need additional work to really evert the lateral aspect of the lip. So there are a lot of options available. And again, it really depends on the patient's desires, goals, and
Their anatomy.
Their anatomy.
Yeah. So what I also wanted to discuss was the fact that people may not realize that lip lift surgery or lip enhancements can actually make you look younger, not only more beautiful, but younger. There is something, and maybe there's a mathematical explanation for it. When this distance is long and this lip is thinner, or I don't know if it's just a ratio thing, and as we age, this can get longer because of gravity. It makes somebody look older. Why is that?
Well, I think it's just part of the facial aging process. Some of it has to do with the soft tissue. The lip itself probably does elongate. Not on everyone, but almost everyone will have some element of elongation. It's probably more noticeable on patients who already have a bit of a longer lip, just based on their genetics, may become more noticeable. But also it has to do with the skeleton structure. So if you do anatomical or imaging studies of patients at certain stages of their life, and you're looking at just their bony skeleton. And there's a lot of literature in the dental world about this. The alveolar ridge, the maxilla start to recess a little bit as you age. And with that bony anatomy shrinking, the soft tissue may have less support and start to hang down. And therefore, some of these soft tissue procedures can be done often alone, but also in combination with some dental procedures, which is a whole other topic.
Yeah.
But the combination of the two sometimes can give the best results. Examples would be patients who are getting veneers, potential dental implants, if they've lost teeth or dentition. Some people are getting all sorts of different dental augmentations in combination with the lip lifting. So they are dealing with the bony skeleton as well as the soft tissue.
All right, so I thought I'd pull out a picture of a couple of patients just for those who are watching, so we have a visual aid to help explain a little bit more so what we're talking about here. So this is a patient. She felt this area here, the white lip, was long. And you can see from surgery, the modified upper lip lift that Dr. Solomon did, it's shortened the length there. So she actually looks more youthful, and she's got a little bit more volume in her upper lip as well. Do you want to describe how you did this procedure?
Yeah, so that's sort of a classic case of a patient who's felt to have the right anatomy for this operation. So she had an elongated upper lip, she had lack of dental show, and she felt that she wanted augmentation or enhancement of her red lip. And so the surgery basically achieved all of those goals by basically just removing some of the tissue just below the nose, shortening the upper lip, and everting the red lip. And it's interesting because I love her before and afters because it really shows how powerful this operation can be in terms of making someone just look more youthful or better looking in general, even when done in isolation. Many of our patients that are getting a little bit older, past 50s, are doing this operation in combination with other anti-aging procedures such as facelifts. But some of these examples that you're showing are, I think, isolated just to that one procedure.
They only did the lip lift, but the lip lift, like you were saying, it's a small procedure. It's not a big procedure to do. You can do it while you're awake. You go home, you're home for about a week, you have stitches in, they're coming out about day 8, and you're good to go. So it's not a big surgery, but it gives a big result, for sure. So here's another sort of example of the same scenario. She had a long white lip, and it shortened it, gave her a full upper lip. Where do you do the incision? Just so people understand, it's not necessarily inside the nostrils. It's not just to the bottom. Sometimes it can go around a little bit, so it can get you as wide of a lift as possible.
Yeah, so it really depends on people's nasal anatomy. So you're going to be trying to follow the natural shadows of the base of the nose. There are really two types of modified upper lip lifts. One of the operations, the incision goes right inside the nose and then out along the base of the nose. That operation I don't tend to do. Most surgeons have avoided doing that because it can distort the actual nostrils and it can move some of the lip skin into the nose. But it can be beneficial, and it's often described in other parts of the world with different ethnicities. The vast majority of patients from all ethnic groups, I think the results are more predictable, less distorting to the nose with the conventional incision where we are following right along the alar crease, following right up to what's called the base of the nose, at the base of the columella, called the medial crest. Often you'll see a little bit of a divergence there, and then we come along the base of the columella and then the other side. And in terms of the width of it, it depends. So we have to take into consideration how wide the patient's nose is and how wide their commissure of their mouth is. So someone who's got a wider nose and smaller mouth, you can really lift the lift
As wide as possible.
as wide as possible. Someone who's got a very small nose and a wider mouth,
Then
you're
it's
going to
more
be
central.
limited, and we're going to be doing more central.
Right.
And those people may need the add-on of the corner lip lift. So those are all sort of some of the considerations that we have to take into account when we're looking at patients' anatomy.
All right, so let's talk about the scar, because a lot of people want this procedure or inquire about it, and they're just a little hesitant maybe because they're worried, how obvious will the scar be? Most often it heals beautifully, it's nicely tucked in and hidden up here so you can't see it. Do you want to just talk about the risk of scarring with this surgery?
Listen, it's one of those operations where it certainly is the biggest consideration is whether there's going to be a noticeable scar. I mean, I'd say that the vast majority of patients, the scar is well hidden. Just like anywhere else that you're having any type of procedure, scarring is not always totally predictable depending on your skin type. So what do we do to avoid the scar being wide or the scar being raised? Is we use 2-layer closure. We're basically going to be putting deeper sutures into the tissue to sort of anchor the tissue so it's not under tension to pull apart.
Yeah.
And then we're doing a skin closure meticulously with very small sutures to try to make sure that the skin edges basically settle in with the most invisible scar as possible. That being said, there's always the odd person who doesn't heal well. Sometimes we have to go back and do some scar adjustments. We have to be super careful because if you take too much tissue, you can distort the base of the nose and distort the lip as well. So
It sounds like a deep plane facelift on your lip.
it is in the sense, some people have sort of coined it that. The word modified is just referring to the work in the deeper layer. So it's not just a skin only operation. We're dissecting down to and just above the orbicularis muscle. And we're going to be doing, sometimes we undermine a little bit of the tissue just around this area to allow us to reposition the lip vertically and make sure that the scar is as beautiful as possible.
So what is the ideal lift? How many millimeters would you say is a good amount to remove, or how much do you lift? How do you figure that out?
So basically depends on the patient's preoperative anatomy. We're going to be doing some measurements. Usually we use little calipers to measure from the base of the nose to the lip. but it's sort of an artistic thing. You don't want to be 100% like a mathematician on it. So you're going to look at their teeth, you're going to look at their lips, you're going to look at their red lip, their white lip, their vermilion border, and their nasal projection, and try to come up with a formula that seems to make sense for that individual patient. In general, women ideally could have a lip as from the base of the nose to the upper lip measuring 1.1 to about 1.3 centimeters. In men, it's usually a bit longer. If you make a man's lip, it should be around 1.5 to almost 1.8 centimeters, I think, are the rough numbers that we use. If you were to reduce a man's lip significantly more than that, they may become feminized a little bit. The problem
What is it about a full lip that makes a face look feminine?
Well, I think there's a whole sort of area of medicine and aesthetics that relates to attractiveness to people, which borders on sexualization of certain body parts. So, the lips are considered sensual or sexual, and for kissing and things like that. That's why people wear lipstick to enhance their lips and shape it to have sort of a plumpness to lips. So there's a whole sort of area of sexual psychology related to lips, which probably plays a role into why we think some lips are beautiful. And then there's also an element of youthfulness associated with the beauty of a young person, has fuller, redder lips. And as they get older, they may start to shrink and become more lined or smaller and atrophic. So it's sort of a indirect signifier to patients when they look at someone of age as well. So I think those are the factors that are going on in the psyche when you're looking at someone. So, and then balancing it in with the other facial aesthetics, lips are one of those features that our eyes are often drawn to, people's lips, their eyes. And that's partially why people wear makeup like lipstick and eyeliner, because our brains are wired to look at certain facial features in a way that it sort of links to whatever we perceive as beautiful. Whereas like nasal anatomy is different. The nose, you want to just de-emphasize it so that it blends in. We're not putting a lot. I mean, some women are putting some type of makeup on the nose to contour it, but in general, you want the nose to be de-emphasized in the background, whereas you want the lips and the eyes and the hair and the brows and the teeth to be sort of what you're looking at. So a little bit is what's in the foreground of the picture of the face and what's in the background. So a lot of that comes into play when you're sort of analyzing beauty.
I get asked a lot of questions from our patients, often, how long has he been doing this procedure? How many times has he done this procedure? So I'm going to ask you the same question.
Sure. So it's interesting you asked that, because lip lifting has been a procedure that I've adopted into my practice since I started, which was in 1999. But at that time, it wasn't considered a popular procedure. I happened to train with a surgeon who did this operation. And I remember discussing the operation because I thought it was super cool and innovative and created dramatic results. And I talked about it with some of the professors that I trained under. And at that time, there was sort of like a major split in the plastic surgery world, where many people sort of looked down on the operation, thinking that it wasn't
There's still some that don't love to do it, I've heard.
Yeah, there's people, I think it's become a mainstream operation, but I think back then it was almost frowned upon as if it's not a good operation, which I found kind of unusual. There are certain things in medicine that sort of tend to trend.
Right.
Anyways, I saw a surgeon do it. The patient seemed super happy. The results were quite dramatic. And I adopted it as part of my practice. But many surgeons in Toronto didn't really like it or do it. That being said, when the internet blew up and then Instagram blew up, there been a few surgeons who made a big part of their career was like platformed off of this operation. They became known as the go-to person for lip lifting. And in the United States, it's a different market. Certain people will fly all over the States just to get that one person who is the parent, the guy who does it. But we've been doing it here in Toronto for over 20 years. And because it became so popular online, our own practice got busier and busier and busier with it. Now I feel like most people in the field of facial plastic surgery, it's part of their procedures that are offered as part of their repertoire procedures, from rhinoplasty, facelifts, blepharoplasty, and lip lift being amongst the most common. Okay, guys, I hope you found that informative. Thanks for taking the time to listen to another episode of Unfiltered. Today's episode on lip lift was, my...
Uplifting?
Yeah, it was uplifting, but I think that it hopefully shared with you sort of the common questions that we get on a day-to-day basis about this operation, which, is really something that can enhance one's beauty. And we're happy to see if you're a candidate for it.